We're going to talk a little bit about patella luxation, which is something that affects a lot of dogs. And I was just saying before we came live that I feel like I see more dogs with luxating patellas nowadays than I did when I first started. Maybe I wasn't recognizing it so much, or maybe it is just more prevalent now. So for those of you that don't know what patella luxation is, could you just give us a little rundown of how you would describe it?
Sure. So the patella is what we call a sesamoid bone. So that means it's a little bone that sits within tendons and ligaments and basically helps those tendons and ligaments function as they should and do their job. So specifically, the patella sits in our quadriceps muscle mechanism. So our quadriceps muscle is that really big muscle that runs all the way down the front of our thigh, and the same as for dogs. And that mechanism comes from all the way up at the hip joint, all the way down the front of the thigh, and then ends up in a little ligament called the patella ligament. The patella sits within that ligament and should sit within a nice groove at the front of the knee. So at the bottom of the femur, the bottom of the thigh bone, there should be a nice groove that sits there. The patella should sit within that groove. And it helps the quadriceps to work as a kind of flexor of the stifle joint. So that's kind of what we want it to do, is to kind of flex and extend the stifle joint. If the patella is in the right position, it will do that. If the patella gets out of that position, then unfortunately we end up with problems. And so patella luxation is when that kneecap, instead of sitting within that groove and doing its job appropriately, is able to jump in and out of the groove, or in worst case scenarios can get stuck outside of the groove completely. So I guess that's what it does, is the patella not being in the right place, and it can move either towards the inside of the joint, which is most common, or it can also sometimes move towards the outside of the joint, so-called a lateral patella luxation.
And when that happens, then what do we expect to see? That the dog can't move its knee quite so well, can't weight bear on it? What typical symptoms what typical signs do we see?
Yeah, so it depends on the grade. So we do grade patella luxation according to its severity. So if we go into that a little bit now, just so that we can kind of refer to that moving forwards. So those grades are in dogs graded from 1 to 4, with 1 being the least severe and 4 being the most severe. So in a grade 1 luxation, the kneecap sits within its groove the vast majority of the time. But if a surgeon or even as an owner is manipulating the leg, they might be able to push the kneecap out. That'll feel like a little click. But the minute you let go of the kneecap, it pops straight back to where it's supposed to be. So it wants to sit in the groove, but it's possible to push it out. So that's a grade 1. A grade 2 is when that patella can move outside of the joint without someone pushing on it. So as the dog's going around doing its normal things, trotting around day to day, the kneecap can pop out of its own accord. And then again, it normally does reduce itself. So it pops in and out, but it does it without someone having to push it in and out. So it's a slightly more severe form. A grade 3 luxation is when the kneecap, instead of sitting within the groove most of the time, actually always sits out. So it sits out of the joint all the time unless someone pushes it back in. So we can push it back in, but it tends to spend most of its time outside of the joint. And then a grade 4 is our worst case scenario. It's the cases we don't really want to see, is the ones where the kneecap is outside of the joint, and no matter what we do during our examination, we can't push it back in. So it's completely fixed outside of the joint and won't go back to its normal home. So clinical signs do depend on what grade of luxation we have. So dogs with a grade 1 luxation generally don't show any signs. They're sitting around absolutely normal, no problems. Owners are completely unaware this happens until the dog comes in for its vaccination. Someone does a full exam and goes, oh, I can do this. A grade 2 is probably the most common one that you hear about with patella luxation. So a dog's walking around and they are walking perfectly normally. Suddenly they skip a few steps. So they kind of just skip a step and then put the leg down. It generally does not appear painful, but the dog just skips a few steps, puts the leg down, skips a few steps, puts the leg down. And the frequency that happens with varies dramatically. So it can be once a week, it can be twice a week, it can be several times a day. It just depends on the individual dog and how frequently that kneecap is popping in and out.
Yeah.
Grade 3s and grade 4s are more severe, and normally you'll start seeing with a grade 3, grade 4, the dogs tend to develop a bit of a bow-legged stance. They stand like someone who's horse riding for years, that kind of like, like sounds like a cowboy, or a like John Wayne stance almost. And so that's something that's very typical that we see with those higher grades of luxation. And if the kneecap gets stuck out and it starts to really move round towards the inside of the joint, so it's further and further out, the most severe thing that we can see is a dog that's actually unable to extend its knee. So instead of being able to flex and extend as they walk, it gets completely stuck in flexion. And if it's one leg that's affected, they normally just carry that leg because it's right up and flexed up, can't be used. If it's both legs, then you see this kind of shuffling stance on the back where they kind of can look quite neurological and profoundly abnormal, actually. So they're the sad ones to see.
So the most common ones would be the grade 1s and 2s, I suppose.
I think so. We see that far more commonly. But I would agree with you. I think we're seeing a greater percentage of more severe cases coming through. And certainly we're seeing more of those that we're operating on, whether that's because people are choosing to operate them, so they're coming to me, or whether it's because they're genuinely more common. I guess we don't know. But